Arrhythmogenic left ventricular cardiomyopathy, or ALVC, is a rare and often underdiagnosed heart condition that primarily affects the left ventricle. Unlike its more well-known counterpart, arrhythmogenic right ventricular cardiomyopathy, or ARVC, ALVC specifically targets the left side of the heart, leading to life-threatening arrhythmias and potential heart failure. Understanding ALVC is crucial for early diagnosis and appropriate management, which can significantly improve patient outcomes. The exact causes of ALVC are still being investigated, but genetic factors appear to play a significant role. Mutations in genes encoding proteins responsible for cell-to-cell connections, particularly at structures called desmosomes, are frequently implicated. While genetic predisposition is a major factor, environmental triggers, such as viral infections or intense physical activity, may also contribute to the development of ALVC in genetically susceptible individuals. More research is needed to fully understand the complex interplay of genetic and environmental factors in this disease. At its core, ALVC is characterized by the progressive replacement of healthy heart muscle, the myocardium, with fatty and fibrous tissue. This process, predominantly occurring in the left ventricle, disrupts the heart's normal electrical conduction system. The fatty and fibrous patches create areas of abnormal electrical activity, leading to arrhythmias, which can range from palpitations to life-threatening ventricular tachycardia or fibrillation. The weakened heart muscle also impairs the heart's ability to pump blood effectively, potentially leading to heart failure. The extent and location of the fibrofatty replacement determine the severity of the disease and the specific arrhythmias that may develop. ALVC is considered a rare disease, making it challenging to accurately determine its true prevalence. Due to underdiagnosis and potential overlap with other cardiomyopathies, the exact number of people affected remains unclear. Studies suggest it is less common than RVC, but precise epidemiological data is still lacking. ALVC can affect individuals of all ages, though it often presents in adulthood. Further research is needed to better understand the distribution and risk factors associated with ALVC in different populations. The signs and symptoms of ALVC can vary widely, depending on the severity of the disease and the specific type of arrhythmias that develop. Some individuals may experience no symptoms at all, while others may suffer from palpitations, dizziness, fainting, shortness of breath, chest pain, or even sudden cardiac arrest. These symptoms often appear during or after physical exertion. It's important to remember that these symptoms are not exclusive to ALVC and could indicate other heart conditions. Therefore, a thorough medical evaluation is crucial for accurate diagnosis. Diagnosing ALVC can be challenging, requiring a combination of clinical evaluation, imaging studies, and genetic testing. An electrocardiogram, or ECG, can detect abnormal heart rhythms. An echocardiogram uses sound waves to create an image of the heart, allowing doctors to assess its structure and function. Cardiac magnetic resonance imaging, or MRI, is particularly useful in visualizing the fatty and fibrous tissue replacement characteristic of ALVC. Genetic testing can identify specific gene mutations associated with the disease. Endomyocardial biopsy, a procedure in which a small sample of heart tissue is taken for examination, may be performed in some cases to confirm the diagnosis and rule out other conditions. The diagnostic criteria for ALVC are still evolving, and a comprehensive approach is necessary for accurate identification. While ALVC doesn't have rigidly defined subtypes like some other diseases, it's helpful to understand the spectrum of presentation. Some patients exhibit predominantly arrhythmic features, experiencing frequent palpitations or fainting spells, while others primarily develop signs of heart failure, such as shortness of breath and swelling in the legs and ankles. The location and extent of the fibrofatty replacement in the left ventricle can also vary, influencing the specific clinical manifestations. Recognizing these different presentations is important for tailoring treatment strategies to individual patient needs. Currently, there is no cure for ALVC, but treatments are available to manage symptoms, prevent life-threatening arrhythmias, and improve quality of life. Medications, such as beta blockers and antiarrhythmics, can help control heart rhythm. An implantable cardioverter, defibrillator, or ICD, may be recommended for individuals at high risk of sudden cardiac arrest. Radiofrequency ablation, a procedure that uses heat to destroy abnormal electrical pathways in the heart, can be effective in controlling certain types of arrhythmias. In severe cases of heart failure, heart transplantation may be considered. Lifestyle modifications, such as avoiding strenuous exercise, are also important for managing the condition. While preventing ALVC entirely is not currently possible due to its genetic basis, certain measures can help reduce the risk of complications and improve outcomes. For individuals with a family history of ALVC, genetic screening can identify those at risk. Regular cardiac evaluations, including ECGs and echocardiograms, are recommended for individuals with a genetic predisposition. Avoiding strenuous physical activity and maintaining a healthy lifestyle can also help minimize the risk of triggering arrhythmias. Early diagnosis and management are crucial for preventing disease progression and life-threatening complications. The prognosis for individuals with ALVC can vary significantly, depending on the severity of the disease, the presence of arrhythmias, and the response to treatment. Early diagnosis and appropriate management can improve outcomes and reduce the risk of sudden cardiac arrest. Recent research has focused on identifying new genetic mutations associated with ALVC, developing more sensitive diagnostic tools, and exploring novel therapeutic strategies. Researchers are also investigating the potential role of gene therapy in treating ALVC. With ongoing research and advancements in medical technology, the future looks promising for individuals living with ALVC.